Hi everybody, it's Michelle here again with birthuhura. Here at birthuhura, I am a full spectrum plant-based holistic doula and an advocate for all things safe, natural, and effective. Here on this channel, we discuss all things pregnancy, birth, and womb health related. So if you guys like the content and you like what you hear, please be sure to subscribe. Today, I'm going to talk about sleep or insomnia during, I guess, the later part of the pregnancy. I had a woman reach out to me and ask me like, I'm this far and I'm so tired, but I cannot get any comfortable rest. Which is to be expected when you're, trailing the end of that pregnancy and, you're bigger, it's a little bit more uncomfortable. Your anxiety is probably up because you know that you're going to have the baby soon. And, there could be siblings involved. There's so many things, so many reasons why we can run into insomnia. A big part of insomnia, though, and the inability to sleep is, and I'm not saying this to the person who, I'm just giving the information. It's diet, obviously nutrition, the things that you eat, put in your body is going to affect how you feel morning, noon, and night. If you're drinking coffee, if you're drinking anything caffeinated, you want to exclude that from the diet. Also, if you're still working, it might be hard to unwind. If you have like, a bunch of stuff going on outside of your pregnancy, it might be hard to like calm your mind and settle down after all of that is going on. So I do find a lot of women are coming into this issue not being able to sleep during pregnancy, especially the latter part of it. So some tips and some suggestions about how you can address insomnia is, first of all, you want to learn how to calm the mind, learn breathing techniques. You want to know, nutrition. What are you eating? What time are you done eating? If you are eating late at night, depending on what you're, eating, could, be heightening your senses and things like that. If you are suffering from insomnia because you have body aches, you want to incorporate some yoga, some stretches, some inversions, so that you can, calm the body and release a lot of that, anxiety and tension. If you are having extreme back pains and things like that, I super, 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 super encourage you to see a chiropractor who is Webster certified so that they can adjust you, so that you can get some kind of relief. I like the herbs chamomile, hawthorn berry, linden later on in the pregnancy, to help you get into a relaxed state, so that you may fall into a good sleep. But these are things, obviously these are herbs and we want to be careful using them. Consult with someone who is knowledgeable about it. But teas like lavender, even aromatherapy. Make sleep a ritual. Go to sleep at the same time every night, or at least try to, so that your body gets into the pattern of, okay, it's time for me to wind down. It's sleep time. Speak to your body. Tell your body, it's time for us to fall asleep. Tell your body parts to relax. To, you can say these things in your mind, and you can go over breathing, and then you can say to your, your legs, it's time to calm down, relax. You can talk to your arms. And I know this stuff sounds crazy, but I do these things. It is your body. You are the conductor, the controller of this vessel. And so sometimes you have to tell your brain, hey, brain, it's time to settle down. It's time for us to go to bed, right? And so, maybe get a pregnancy pillow, a good one that always is helpful. If you have a partner involved, have them, massage your feet or massage your legs, and You know, so many things that you could do to address this, but I think having a balanced diet, going to sleep around the same time every night, get a good shower, drink a nice cup of tea, not right before bed because you're going to be up peeing, but, you know, drink a nice cup of tea to wind down, to calm down, practice those breaths and breathing so that your body can concentrate and focus. And, you know, don't watch TV at nighttime. When you're in the bed and you're watching TV, that, you know, rattles the brain and you got all of these things going on. So it can be hard for you to go to sleep. But yeah, stretching. If your insomnia is severe, I definitely encourage you to go the herbal route and to make a blend that will help you relax and fall asleep. I mentioned some of those herbs. Please be careful again because herbs are not one size fit all. And so I don't, you know, depending on like what your history is, depending on your other, if you have issues, you definitely don't want to just jump into using whatever. Some herbs are very nourishing herbs and they don't really cause side effects, but you still want to know what you're doing, what you're taking, and when you're taking it. But yeah, insomnia doesn't have to happen. You can have great nights of sleep, even in the latter parts of your pregnancy. 35, 36, 37 weeks, you could be sleeping really well. Just like I said, you have to train your body, you have to train your mind. You have to stretch daily, and you need to just get into the mindset of, you know, just controlling your vessel so that you can get to the state of sleep that you want to be in. And like I said, if you're in pain, then you need to address that. See a chiropractor, move those muscles. And yeah, that's pretty much it. You can also use sound therapy. I like affirmations, meditation music, soothing sounds, maybe like nature, sounds of the rainforest, just different things like that. If you are into sound bowls, I love sound bowls. I have this one, but I also have like really huge crystal sound bowls. They are amazing. They're awesome for calming you and putting you into a deep, relaxed state. But these are just suggestions. I know that it can be difficult to sleep when you're carrying an extra 20 pounds, extra 30 pounds. But it is definitely possible to address insomnia. Of course, it's not going to be your best possible sleep when you are, you know, at the end of the road and you are getting ready to have that baby, because there's just so much going on. You're nervous, you're excited, you're anxious, you're ready, and then you're not, and all of these different things. And so, you know, you're up wondering, do I have everything situated? All of these things go into it, but you definitely don't have to suffer and not sleep at all. Like that's just not, because you need your energy, you need to rest, you have to be able to have the strength and the energy to go through the birthing process. So you don't want to be sleep deprived, especially because after that baby is born, that baby is going to need a lot of your attention. So just check out those things that I talked about. If you have tips, if you're somebody who's watching, you have tips for sleeping, please drop them in the comments for somebody else to see, because you may be able to help someone, help a family. And if you have a topic that you would like me to talk about that I haven't already discussed, please reach out to me at birthuhura@gmail.com. And I thank you guys so much again for coming and tuning in. I will see you guys for the next video. Yes, and I'm Michelle. Doula and birthuhura, and peace and pregnancy deaths.